Hi everyone, my name is Ashley.
I'm Stacy.
I'm Brandy.
I'm Kendall.
And I'm Taylor.
And today we're going to be talking about the OT role in homeless and community living programs. So we found two evidence-based articles that we pulled a lot of our information for this presentation on. And so I'm just going to introduce the first article right now. And it's entitled Occupational Therapy and Health Promotion for Families Experiencing Homelessness, a Community-Wide Approach. So this article seeks to answer the question, how could occupational therapy lead to improved outcomes for health and independence for families experiencing homelessness? This was a doctoral capstone project, and it was completed through a systematic needs assessment by interviewing both service providers and recipients of homeless services. So these service providers included leadership and staff at homeless shelters and libraries and local food banks and stuff like that. And then these recipients, there was 9 total individuals from families experiencing homelessness. So the results of that systematic needs assessment were compiled into a matrix for analysis, and it found that families experiencing homelessness needed and wanted more occupations to engage in. So that was something that they would like to have. And then the service providers wanted to increase programming to address stuff like life skill development for families and to improve their health and economic outcomes and stuff like that. So essentially, the article concludes that the OT's role is just to analyze service community strengths, weaknesses, opportunities, and threats, and stuff like that. Yes, so that's all right. Justify incorporating OT, and then to also provide goals and strategies to make that incorporation possible, which will be covered more later on in the presentation in detail. So the second article is called Occupational Therapy and Integrated Primary Care, Addressing the Needs of Individuals Experiencing Homelessness. So this article is answering the question, what are the initial outcomes of occupational therapy services to individuals who are homeless to increase self-management and home and community participation? So it's a retrospective descriptive evaluation of OT services and client outcomes, which was measured by the COPM. And the results indicated that analysis of overall improvement in performance and satisfaction demonstrated significant improvement on goals for those that engaged in the intervention. So the OT intervention was positive. And then the participants who engaged in OT services demonstrated improvements in functional goal areas as indicated by the COPM, despite the presence of mental health diagnoses or chronic medical conditions and other impairments and homelessness. So essentially, OT was found to be well suited to address client goals in this complex population of homelessness, and has mental health and medical and cognitive needs to improve functional performance and enhance services for people who are homeless.
Okay, so I'm going to be discussing the psychosocial impact on the homeless population. Those who are homeless have increased feelings of anxiety, depression, typically will have more substance abuse, PTSD, chronic health conditions, and overall decreased physical and mental health, which all can lead to decreased cognitive performance and the impact on overall cognitive function negatively. And many shelter curfews and schedules can hinder their basic self-care needs and social interactions. Many shelters focus on meeting the basic needs of shelter, food, water, which are all necessary but can sometimes be lacking, and meeting the self-care needs that lead to decline in health. And most goals from individuals at an OT standpoint who are homeless usually will focus on survival instead of occupation, which points back to how their self-care needs are not being met. And even after maintaining stable housing situations, previously homeless people will still experience decreased community engagement, social involvement, and a lack of meaningful activity in their days. The social stigma of being homeless, whether they still currently are or not, contributes tremendously to the lack of their social integration.
Okay, and so now we're going to be talking about just like a typical role of what an occupational therapist does in the homeless population. So the typical role of an occupational therapist that's involved with the homeless population includes advocating for the individuals and getting them the resources that they need. OTs use their connections and resources to help enhance the quality of life for others. So for example, OTs can get involved with the shelters to not only just look at their policies, but they can look at their meal times and their curfews. Another way OTs can get involved with this population is to get them involved in sporting activities or events, which provides opportunities for social bonding, which helps enhance any psychosocial factors that the individual may be experiencing, such as anxiety or depression. They are also concerned about the population's safety and their occupational engagement when performing ADLs and other meaningful tasks. OTs can also hold educational seminars that are free to the public, and these seminars can provide resources such as child and family services information, which can help improve the overall health and wellness of this population. And the purpose of having OTs involved in this population also is to enhance not only their quality of life, but just to get them better and just encouraging them to better themselves as an individual.
Okay, so now I'm going to talk about occupational's potential service for the developing community. So occupational therapy has the potential to help serve the homeless community in many ways. Because OT's role in the homeless community is still fairly new, there's still a lot of in-depth research that needs to be done in order to gain a more solid understanding of what the homeless population will benefit from. And then the more studies that we do will allow us as OTs to use occupational-based evidence practice when making our care plans for the homeless. Our OT in Community and Populations Health Practices book states that the overarching goal for occupational therapy intervention with persons living with homelessness in shelters is to maximize person, environment, occupation fit to enable participation in the immediate shelter environment and to reconfigure person, environment, occupation fit to enable greater participation in the community. So as OTs, the services for homeless continue to develop. Good evaluation is key to giving the best possible care. The OTs need to evaluate for overall occupational performance, but it is imperative that they also screen for depression, anxiety, PTSD, and substance abuse because these mental health issues are so prevalent amongst the homeless community. The interventions used on the homeless population focus on life skills training, which includes safety planning, drug and alcohol awareness, safety advocacy, coping skills, money management, safer sex practices, personal hygiene, and leisure exploration. Enriching occupational repertoire, education and employment services, which help to provide the skills and knowledge needed to apply for and maintain employment, child and family services, which include promoting intimacy among parents and children, developing a family legacy and engaging with the community, and then finally transition into a stable housing environment. So the development of OT services for the homeless community is growing every day and will become great as we continue on into this environment. Now Taylor's going to tell you about what OT brings to the homeless community.
Okay, so here I'm going to talk about what occupational therapy can bring an impact to the homeless setting. And so first of all is a work readiness program and to put them through a training in that sense. A lot of homeless people may be more comfortable in a one-on-one setting, but it would be good to do in a group treatment setting as well to incorporate some social interactions and bonding like Kendall was talking about earlier. And it'll help prepare them for that program in order to find a job. And for a work readiness training program, the OT would help them identify a meaningful occupation that they have and their career interests that they might have. Then they would help refine their job search once they figure out some of the occupations that they do like and might want to pursue. They'll assist with the job application itself, and then they'll create a resume, of course, and they'll definitely practice interview skills because a lot of homeless people might not, like I was saying, have that social bond and communication skills, verbal or written, and so that would be great to work on in a session as well. And then, just educating the patient on work etiquette and behaviors that you might have for the occupation that they have picked or, might pursue. And then you would also want to educate resources in general. We want to advocate for our patients. And so whatever area he or she is in, finding that free healthcare clinic, OT services and mental health and things like that. OT would provide a lot of functional based rehab services, and this is very important in order for them to get back into the community and with their family too. And so it's important to be a part of the community and just to get back into that setting. It's really difficult sometimes to put yourself back out there if you hadn't been doing it for a while and transitioning to that home environment. Something else for a resource is something like Meals on Wheels. And depending on where you're located, it could be called something different and things like that. But they could, bring a meal to you, or there's a location where they cook every day or things like that. Something else is very important, and looking at that first research article that Ashley was speaking about earlier, it was talking about self-efficacy. And they were saying that in the study that homeless individuals who sought out OT services, in a sense, they just really didn't believe in them. And so they worked on self-efficacy more because they need to have good thoughts and feelings about themselves in and out of the treatment room. And therefore, they kind of apply it to real life as well. And until they do that, they don't necessarily have a positive outcome. And as OTs, we are going to advocate for our patients once again. And so applying those therapeutic interventions to real world situations is very important. And like I said, to get them back into the community and just preparing them for that transition and whatnot is very important. Self-efficacy will go a long ways. That is the primary thing that OTs do look at. That way they have that social and community bonding that they have been lacking. And then, just talking to them, giving them some counseling if they don't have those services just yet, and educating them what's in the community and where they are. And so that's what OT can bring an impact to that setting.
Yeah, so overall, occupational therapy definitely is an up and coming field within, or area within the homeless population. And there's a lot of up and coming evidence that it could be very beneficial to people who are homeless, and helping them with their self-efficacy, with their job search, and with more intimacy with their families. So yeah, we appreciate your time, and here's our resources.